Hello, welcome. My name is Catherine Bertini, and I'm a Distinguished Fellow at the Chicago Council on Global Affairs. Thank you very much for joining us today for this conversation. Thanks to the members of the Council and also to all those around the world who have joined us. We're going to take about 30 minutes for a conversation with our guest, and then we will take questions that have been submitted to ccga.live. So please submit a question there or vote for others. But now we want to go right into the seminar and talk about our topics today with the Right Honorable Helen Clark. Helen served 3 successive terms as Prime Minister of New Zealand, starting in 1999. I remember visiting with her, in fact, when I was the head of World Food Program and went to call on her in her office in New Zealand. She became then the head of the United Nations Development Program. She was the administrator there for 2 successive terms, starting in 2009. And now she has the Helen Clark Foundation, which is involved in many different programs, including some issues about how to deal with the next phases of the pandemic. Helen is a frequent contributor in many areas, including to the Council for the Program on Cities and to the discussions that we've had on leadership. And today she's going to share her expertise about working across governments and multilateral institutions. So welcome, Helen. Thanks very much for joining us, and be sure you've unmuted yourself, and we'll go.
I'm unmuting now.
Okay, thank you very much. Well, we want to start with talking about some of the main leadership challenges that we see, and in particular, how national leaders and multilateral leaders are dealing with them. And I wonder if you have some thoughts about, for starters, with what's the role of multilateral leadership versus national leadership in fighting the pandemic?
Well, thanks to Chicago Council once again for the opportunity to contribute to an event in this new way of working where we spend a lot of our lives on Zoom or other equivalent platforms. And I've been giving a lot of thought as I observe what's happening at the international level and the national level with the response to COVID-19. We'll probably come back to the national level in the conversation on the leadership side, but clearly there's outstanding examples of leadership and some which don't look so great. But at the multilateral level, I do have a deep concern that the system has not been able to rise to the challenge. So why do I say that? Firstly, I'm mindful that if we go back 6 years, we had a public health emergency of international concern declared over Ebola. And at that time, the Security Council stepped up and it declared that Ebola was a threat to global peace and security. And it called on every member state of the United Nations to do whatever it could to address that threat. We have not remotely got near that with the Security Council in this pandemic, which clearly has far greater implications for health and well-being, economies and society than what we ever saw materialize with Ebola. So we have to say, why is this? And of course it relates to the rather toxic nature of geopolitics at the moment. I think most members of the Security Council, most members of the UN General Assembly would want to see leadership from the Security Council, but there are obstacles. Now, I thought a particularly low point for the Security Council was last Friday, the 8th of May. And what happened last Friday was another attempt at a resolution well short of the Ebola precedent failed. It was an attempt by the French and Tunisian governments to have the Security Council endorse Secretary General Antonio Guterres's call for a global ceasefire of all hostilities so that everyone everywhere, whether it was the Houthis in Yemen and those who are fighting them, could put that aside and focus on your people and their needs and stopping transmission in the pandemic. And that resolution failed. It failed because of an objection to a reference in it to supporting all relevant United Nations entities, including the specialised health agencies. And that reference didn't find favour. Now, the irony of that failing on that day was this, that the 8th of May, 40 years ago, was the date when smallpox was officially declared eradicated. Think about that. In the years before that, countries across the geopolitical divide had come together to say, this is a common cause for humanity to eradicate smallpox. We could do it then. What is it that is wrong with our world today and our global leaders today that we can't find that same unity of purpose that we found on smallpox and we found on Ebola 6 years ago?
That's a really interesting perspective. When we think about Ebola, that was for all the members of the Security Council, the permanent members, somewhere else. And they were helping for Ebola not to get worse where it was and not to move to them. So is there a difference between supporting a problem nowadays to supporting a problem that's somewhere else versus in our own backyards, particularly in the backyards of the permanent members?
I guess so. I was at United Nations Development Programme during the Ebola epidemic period. And while there was concern that it would spread, and of course, as we know, a small number of cases did turn up in the US and in Europe, but very, very quickly and efficiently dealt with. I was one who was traveling at the time, and I went to the 3 Ebola-affected countries, and I got, very stern welcome from the New York health authorities when I landed back at JFK. So, New York and all the big airports in the States and Europe, they were absolutely on the alert and the lookout, and the worst didn't happen. But this time, amazing as it may seem, from the time we knew about Ebola and from late January, 31 January, when it was declared a public health emergency of international concern by the World Health Organization, in a way, the richest countries in the global north, if I could put it that way, kind of sat and watched it happen, almost as if, like Ebola, it probably won't happen to me. And then it came on like a tidal wave. And at that point, everybody became incredibly focused on their own situation. And there's always a lot of politics about how own situations are managed. And sort of moments and opportunities were lost where there could have been an early global response which might have averted this catastrophe that we've seen play out.
Right. Helen, before we leave the multilateral, what else could the UN or Secretary General have done? Do we have to have the Security Council act before the UN acts in such a crisis?
A couple of points to make here. Dr. David Nabarro, who I met when I first came to the UN, very experienced international public health official who used to advise Ban Ki-moon on pandemics. He's made a call, and I've endorsed it publicly, as have others, that ideally the Secretary General would announce that he's forming a pandemic emergency coordination council, do it on his own authority, have Dr. Tedros from WHO on it, have Kristalina Georgieva heading IMF, and the head of the World Bank. Those most powerful 4 senior international officials had a council, each reach out to their constituencies. And let's face it, the finance minister constituency that relates to the World Bank and the IMF is the most powerful constituency in any government. If you can mobilize them, you can start to get some action. So in my view, that's a step that could be taken. It doesn't need permission. Another step the Secretary General could take, and I raise it knowing that no Secretary General has ever taken it, but it's in the Charter, Article 99, is he could go to the Security Council and formally say to them, I am putting on your table in front of you the fact that I consider this to be a threat to global health and security, and invite them all to step up. That's a possibility. One more point about the multilateral system, and here's another precedent. In 2009, the leaders of the G20 rallied to stop the global economy going over the cliff. And they rallied with the $1 trillion package, which helped the International Monetary Fund particularly, but also to some extent the World Bank, help countries that were facing an emergency situation with their finances and their economies. Now, hello, we haven't really heard of that level of commitment from the G20. They have had a virtual meeting, but they all talked about what they were doing with their own economies. But what is needed, and I'm in continual conversation with Prime Minister Gordon Brown, who led the response in 2009, what I'm hearing is that probably we need a package of about $2.5 trillion, and the G20, which represents 85% of the world's nominal gross domestic product, is the organization that can bring this together. Already, as of checking yesterday, 102 developing and emerging economies have gone to the IMF asking for emergency assistance. The IMF right now does not have the resources to meet the demand that it has. So it is quite urgent that the G20 steps up. I've been part of a letter with Gordon Brown and many other former leaders to G20. We're formulating another one as we speak now that we're seeing some weeks on the pandemic crisis blow out into this full-blown economic and social crisis. And we're really calling the leaders in that setting to step up.
Yeah, good. Well, as we see from the U.S. perspective, a lot of money going into the U.S. economy from the federal government. We can only imagine that this is multiplied 193 times around the world for necessity. Not all, obviously, needing the help from the multilateral institutions, but certainly many who do. So that certainly makes sense. I think maybe we just should spend just a couple of minutes on WHO before we move into kind of national governments. And WHO has been criticized quite a lot from the US. And from my perspective, WHO is absolutely critically important. And Dr. Tedros is leading it as well as anyone could. But it's not a perfect organization. And certainly in the post-COVID or post-crisis, and we'll get to that too. What's the definition of post? But in the post-crisis time, perhaps there could be some discussion about how to make it better. I think part of the problem is that the expectations for what it can do and the reality of what it can do are not necessarily the same. But I wondered if you would share with us, some of your thoughts about the leadership role of WHO.
Well, the leadership role of WHO is critical because it sets out the guidance globally for how to best avert the pandemic and stop transmission. I think in the circumstances, it's by and large done the best that it could. The circumstances, of course, have been a fast-moving situation. Probably declaration of or notification by China to the WHO wasn't as timely as it could have been. But within a month of that, the WHO had declared the public health emergency of international concern, and it has been shouting till it's hoarse about the things that need to be done, which many countries didn't adopt quickly enough. But for sure, when we're through the worst phase of this, the WHO will want to do a review of its performance, maybe even commission an outside review and learn from it. It did that after Ebola, where its response was really found to be wanting, too little, too late. But this time, a much better response. But you can always improve and learn from it. Now, as for looking forward, there is some discussion that I'm hearing and have been phoned about as to whether we need a new international convention that covers pandemics and member states' responsibilities. It won't be easy to negotiate, but some are saying, what if it had the kind of powers that the International Atomic Energy Agency had? and that if you ratify this convention as a member state, you will undertake that you will accept visiting inspection missions. You will undertake that, the moment you even sniff something like a novel a virus, you will notify the WHO. In other words, many more powers. At the moment, it's all really a bit of hope and a prayer that people will do the right thing, and clearly, that isn't always enough.
Yeah, interesting. Thank you. Let's shift for a minute to national leadership and some of the strengths that you've seen. So I guess some of the categories of leadership that you've seen in countries that have done very well in terms of dealing with this outbreak. Of course, you've had asked many times, I know, the questions about women leaders and that many of the countries that have done really well have been led by women. But I wonder if you see certain kind of characteristics in the leadership of the countries that have done well in managing the crisis.
Yes, I do. And I have made the comment publicly that on average, the women leaders appear to have handled the crisis rather well. And that relates to many of them having a particular leadership style, which is not unique to women, but has often been more associated with women. Where men adopt that style, they actually also do rather better in the business world as well as in the political world. And that is a style which is more inclusive, less hierarchical, more prepared to be consultative and to listen and to communicate. That's certainly worked a treat here in New Zealand. There has been very clear communication now for well over 2 months as to what the government was going to do, when it was going to do it, inviting citizens to come on the journey, playing to the team of almost 5 million New Zealanders to be part of it. So that leadership style has worked very well here. It's worked in Germany, it's worked in Denmark, it's worked in Norway. In Norway, Prime Minister Erna Solberg held a public consultation with children. She wanted to know how children were feeling, what they were thinking. Can't get more inclusive than that. So there are definitely some lessons to learn from which leadership styles worked.
Yeah, right. And those leadership styles are going to be important now over the long term. Just before we started this broadcast, you were talking about how you don't believe this is going to go away anytime soon, and so we need to be planning and leading for the long term. And perhaps you have some ideas for things that any of us need to be thinking about in that context.
Yes, and I think a first duty of leaders is always to be upfront with citizens about how they're seeing the situation play out, and I think in this case very much be guided by the scientific consensus that emerges and the implications of what we're hearing. So one quite disturbing new report that's just hitting the Twitter sphere and the media wires now is that there's been a major survey done in Spain, a terribly affected country by COVID-19, on what is the proportion of the population which has antibodies right now to COVID-19. And they found that across all of Spain, it's only 5%. And in Madrid, it's only 11%, despite this carnage that we've seen. Now, what people are saying is that this clearly means that huge proportions of populations have not been infected. If you just sat back and let infection proceed, well, you're going to see more carnage. Some are also concerned that this is going to make the development of the vaccine rather more challenging. So, those who are saying that we face a risk of this being somewhat endemic until and if there can be a vaccine, and we're going to have to, if you like, institutionalize in our lives as societies, as individuals, families, a lot of the basic public health measures that we took in the emergencies. This is this is the realistic way to look at it. We can't think that we're going to be snapping out of this northern summer, following northern summer. This is around for a while. It's going to be extremely, extremely challenging. So transparent, open, upfront, honest leadership that says, this is the way we're reading it, this is why, here's the evidence. I think there's going to be a premium on that kind of leadership.
Mm. And what about courage as a leadership, as an aspect of leadership? You know, when you and I talked about leadership a year ago or so, courage was a new word for me in this context, because I think of courage as, you know, the tough woman or man out fighting something, maybe with their bodies. But now I think of courage, you're like a firefighter or something. But now I think of courage from a perspective of a leader of a country, a leader of a UN agency, a leader of a community, and how important it is to be tough. Could you talk about that?
And I think in the situation we're facing now, it will be the courage to admit that you don't know it all. We don't know it all. We're acting in an environment of highly imperfect information. We're learning more about this virus as every day goes by with every new piece of scientific and medical information. But I think leaders need to say, actually, we don't know. Here's the best forecast we have. It may change, but take the people into your confidence. Have the courage to invite people to come on the journey with you. Don't pretend you know it all. That would be quite disastrous, because we don't and we can't.
Yeah. We have quite a few questions, Helen, about the role that a leader should understand as it relates to connectivity and information sharing. And specifically, people want to know, given your career, you've seen a lot of data technology, you've seen it change a lot in the world. And so the question is, are you optimistic or pessimistic about what COVID-19 will do for connectivity and information?
There's an old saying, it's an ill wind that blows no good. So this has been a horrifically ill wind. But out of it, we've also learned quite a lot. And one of the things we've learned is that actually you don't need to get on congested public transport or a congested freeway to go to work at rush hour every morning, or indeed at all. I saw a flash across the TV screen yesterday where the head of Twitter said the staff don't need to come back to work ever again. It's just going fine for us. Now, of course, this doesn't apply to every workplace. If it's a process factory that people have, got to be on the line and got to be packing and distributing, that's different. But for so many now, the work can be done online. So we may find the whole pattern of work changing. Additionally, while people have felt the break from physical contact with families, nonetheless, because of connectivity, granddad can still see the grandchildren on FaceTime or WhatsApp or whatever. So, I think that ICT has really come into its own on this, and that excites me as someone who's very interested in ICT and the communication possibilities.
Yeah, yes, absolutely. Of course, the next, one of the many next steps is going to be if many of us work more from home, or at least don't go on long commutes, then what does that mean for the housing market? What does that mean for the commercial real estate market? What does that mean for are the communities that have been built around public transportation and everything else? So I suppose there's both a short-term and a long-term potential answer to that.
Well, that's right. And actually, for those who've been trapped in high-rise, they may well be thinking, is this the life that I wanted? What about where I came from in small town or rural America, for example? Maybe with ICT and the nature of the work I have, if you can work remotely, maybe I could have a different life. I was just on a call with a friend, professor in London, who's evacuated to Yorkshire. He says, I don't know whether I ever want to go back. A lot of people are thinking like that now. In Spain, where the living in Madrid is very much kind of mid-rise apartments, and there's a totally depopulated rural landscape. Maybe those who can work remotely will think, I could go back there. I could have a different life. Lockdown would certainly be different if I had my backyard or small farmlet. So I think there will be adjustments, and you're right, there will be implications for the property market in our central cities.
Mm-hmm. Yeah, absolutely. Absolutely. There is a question again about New Zealand. I know you can't get away from these questions, having led New Zealand and then having such a distinguished successor in the role now. Some folks want to know more about why New Zealand has gotten this kind of attention, which I suppose gets back to some of what you referenced before in terms of some of the things that New Zealand has been doing. But I think it's become a country that many look to say what is so good about what's happening there, and why is it happening? How can we learn from it?
So I've been involved in a lot of conversations about this in the social media sphere, because when some raise that New Zealand's done well, others will just dish it and they say, oh, they're a set of remote islands, that it doesn't apply to our situation. Well, I'm sorry, what was done here does apply to everyone's situation, because we could have squandered two advantages that we had. One is that we are geographically remote, the most geographically remote Western country. The nearest neighbour kingdom of Tonga, 1,000 miles away. But we could have left our borders open and taken no measures and seen the carnage that's played out in other countries. We didn't do that. We did close our borders to travellers from China at the beginning of February, from Iran, and we do have a population going back to refugee times from there. That closed in February. And then in mid-March, it was signalled that within 4 days, by midnight 18th March, the border closed to everybody who was not a New Zealander or a permanent resident. And then all the measures were put in place around returnees. We could also have squandered the advantage of being at the end of the line and having COVID-19 turn up relatively late. But then, as I said earlier, a lot of countries just sat and watched COVID-19 come at them and did nothing. Thirdly, I think a critical element in the New Zealand response was that initially, as with many countries, we started with a flu pandemic plan. And by early March, it was apparent that you couldn't deal with this the way you dealt with the flu. With the flu, you have the free immunisation for the over 65s. You're doing your very best to protect those who are older and have a vulnerable health condition or are essential workers. We don't have a vaccine here. And secondly, looking at the carnage that was happening, it was clear that just trying to flatten and manage curves wasn't going to work at all. At that point, the New Zealand government declared a new strategy by early March, an elimination strategy. What that means is zero tolerance of the virus. And at that point, you really go hard, and we went hard and early, after the classic approach in public health of testing, contact tracing, and isolation. We had to build capacity fast. We didn't have the capacity to test and contact trace at the beginning. We certainly have it now. Now, the last 2 days, we've had 0 cases. Before that, it was kind of 1, 2, or 3, 0, 0. We know where every single case has come from, even at down at this level. It's either a returnee who's in quarantine for 14 days at the airport, or it's someone from a known cluster. We've got it nailed. And as long as the borders are sealed, we'll continue to have it nailed. The issue is, if we open up to Australia at some point and they don't quite have it nailed, can we keep it nailed? Should we even open up? But we have used the advantages that we've had to have a highly effective response, well communicated by a Prime Minister, and actually quite a charismatic Director General of Health has been right onto it. So I think there are things to learn from the New Zealand experience.
Yeah. One thing that points to, I mean, at least the role of the Prime Minister and the role of the Health Minister, and I think this gets lost in the international multilateral system, is that the Health Minister handles health, and she or he advises the head of state or the head of the UN. And in the case we were talking about before, they shouldn't be assumed to be the one that can handle everything, because health is their mandate. They are perhaps the principal advisor to the top political leadership, but their mandate only goes so far.
Well, we have been so fortunate that a relatively new Director General of Health, who's a public official, a public servant, has a strong population health background. And you couldn't have had a better person in place at that time. So, I'm a great admirer of the work that Dr. Anthony Fauci has been doing in the US. Well, our Fauci is a charismatic Director General of Health here who's had enormous influence on the way that this is played out.
That's great. That's wonderful. I want to circle back to the role that you had, the two roles you had, because several people want to know about the differences you found between running a country and running a UN agency. What the question is, what is the difference between running a country and running a large multilateral organization? Are the skills required the same?
Well, the skills required are generic leadership skills, and they do transfer, but the jobs are quite different. I used to say that as New Zealand Prime Minister, you had more power, but clearly less influence on a global scale. On the other hand, I really loved 9 years as New Zealand Prime Minister. It was the peak of my career. And what I loved about it, and you don't have this in the multilateral system, is you do have the power to execute decisions for a whole population. You have the power of being a decision maker who can change policies, change lives, change things for the better. In the multilateral system, you are, in a sense, a coach. You exhort, you urge, you put information. But in the end, governments have got to make decisions, and they can completely ignore what you're saying, as we've seen with the WHO advice, for example. So it's a different sort of job, very important job. You can have a lot of influence, but it doesn't have with it executive power to make decisions that will impact positively for populations.
Is it fair to ask which bureaucracy was easier to maneuver through as the lead?
Absolutely, the New Zealand government bureaucracy, which had been through huge public sector reform, was very performance oriented. You had, certainly in my time, the caliber of advice was good, and you could build it up. You knew in the New Zealand government, when you went through a proper process of policy making, and we do have a lot of public engagement and expert engagement as well, when you made a decision and announced it, you expected to be able to implement it and for it to be a success. So you had policy making capacity and you had policy implementation capacity. Now, that's a lot tougher in the US.
Yeah. Yes, it is. Helen, we talked a little bit earlier about the role of the government and of leadership, before we started the public conversation. But one of the questions I think is really important is, how can leaders engender in their communities a sense of communal responsibility over individual needs? And that's, I think, a particularly important question coming from in the U.S. right now. I don't know where the question comes from, but that's something that we could all use your guidance about.
So, and particularly pertinent to the pandemic crisis, what is abundantly clear is that no society can hospitalize its way out of this crisis. By the time it's got to that, it's game over, sadly, for some of the worst affected. The only way to fight this is through the classic public health response, which is built on huge public engagement. And so it's not going to be fought by leaders issuing decrees. It's going to be fought by leaders inviting the population to walk with them, take these measures, observe them for as long as it takes to get on top of this. Without an engaged public, nothing will work. Now, I saw this at work in the Ebola response eventually. And, let's go back to the early days of that, where when the disease first started to appear, the first response was to send in people in moon suits who would go to a community, remove a body, bury it, and people didn't know what on earth was going on. And there were cases where in some of the societies, people were digging up the body after the moon suit people had gone and then getting infected. We never got any traction on pushing back Ebola in West Africa until the communities were engaged. And actually, in the end, the level of engagement was inspiring. I remember on my visit in February 2015 to the 3 countries, going to a very precarious hillside informal settlement in Freetown, where that community took the decision to completely barricade themselves off from the rest of Freetown. No one could enter. Your relative from the countryside couldn't come. They kept themselves safe. I remember going to the West Point, paradoxically, informal settlement down on the seafront in Monrovia in Liberia, and meeting the young people who have been mobilized to canvass through the community continually, asking people, please disclose, is there anyone sick, and how to identify where the cases were, and then to have others pick it up and take it from there. So community mobilization to fight a pandemic is critical, but maybe we can also learn from that community engagement is vital in any societal endeavor, whether it's getting our carbon footprint down or, building more inclusive and caring communities. If the community isn't with us, we can preach from a podium all we like, but nothing much is going to change.
Right. We have one more question, but perhaps you can use the answer with any other sum up that you'd like to do as well. And that comes back to the multilateralism issue and thinking of the next steps that should be taken by national leaders and in the post-pandemic process. What can be done to work to strengthen the multilateral system in the context of working our way through the post-pandemic steps?
This year is the 75th anniversary of the signing of the Charter of the United Nations in San Francisco in the United States of America. So if it hadn't been for the pandemic, the UN would have had probably a reasonably clear run to be trying to engage member states on forward thinking about the next steps. Now, sadly, because of the pandemic, it has exposed a lot of the shortcomings of the member state based parts of the UN. When you talk about the UN, there is the entities which you and I know because we've led them, World Food Programme and UNDP respectively, but then there's the member state organs like the General Assembly and the Security Council. Security Council has failed. Now that, given it's the 75th anniversary year, is cause for reflection. If we go back 15 years, I understand it was at that 2005 high-level segment of the General Assembly that heads of government agreed that there should be a process of discussions and negotiations about reforming the UN, leading to a general conference which would examine that. I think that idea needs to go back on the table. The negotiations have gone nowhere, and there's never been a general conference. Maybe the general conference needs to kickstart the negotiations. But I would think that a 75th anniversary year is a time again to be going back to that reform agenda and say, what would make it work better?
Wonderful. Thank you so very much for your insights today and for sharing some of those, especially through the leadership that you've given to your country and the world, and to the UN and the multilateral institutions. We're most appreciative. We're appreciative that within all the things you do now, that you took time to meet with us today. And we thank you, Helen Clark. We thank the audience for tuning in, and we know you can also see this over again if you are so enthused that you'd like to watch the Prime Minister once again, because the Council has a YouTube channel and it will be on the Council's website on the YouTube channel. So thank you everyone for joining us today. We hope you take good care, stay safe, and help build better communities, better countries, and a more collaborative world in dealing with crises like this. Thank you.